take everyone's time. Okay, so welcome everyone. I see people joining from across the state. My name is Melinda St. Louis, and I am the Director of Public Citizens Medicare for All campaign. I'm thrilled to welcome you to tonight's Illinois COVID-19 Medicare for All Town Hall that is co-led by the Illinois Single Payer Coalition. And it's co-sponsored by Physicians for a National Health Program, Jane Addams Senior Caucus, United Electrical Radio Machine Workers of America Western Region, Business Leaders for Healthcare Transformation, Center for Health and Democracy, Progressive Democrats of America, and Our Revolution Illinois. We are extremely thrilled to have ASL, sign language interpretation tonight. I know Diana Thorpe is with us. I think we have a couple of others, and I apologize, I don't have your names. But we'll be hosting this meeting in gallery view so that you can see the interpretation. And I'll ask the speakers to turn your cameras off unless you are, or the panelists to turn your cameras off unless you're speaking, so that it's clear who is speaking. We've gathered virtually here tonight, really during mind-boggling times. The COVID-19 pandemic has laid bare the dangers of our profit-driven healthcare system. And many of us and our loved ones have been touched personally by illness, job loss, financial worry, parenting challenges, and fear for the future. Illinois alone has nearly 350,000 confirmed COVID cases and nearly 9,500 deaths. The unemployment rate is still over 10%, which is much higher than the national average. And this is especially terrifying when health insurance is tied to employment. But Illinois activists are resolved to work to transform our healthcare system. And that's what tonight's town hall is all about, to learn from experts about Medicare for All and how to get involved in our communities and take action. We're honored to have with us tonight an all-star panel, really, led by Representative Chuy Garcia, who was an early co-sponsor of the Medicare for All Act of 2019. We also will have Cook County Commissioner Brandon Johnson, who championed a successful Medicare for All resolution last year in the commission, Alderman Matt Martin, and Illinois experts from across the state who will discuss racial justice, economic, labor, and public health implications of Medicare for All. So please engage with us. Write your questions and comments in the chat box. Our speakers will do their best to respond in the chat or through the Q&A section at the end. If we don't get to your question, we will follow up with you afterwards because we want you to be engaged in this. So now I'm really happy to turn it over to Nidhi Shastri, who is an organizer with the Illinois Single Payer Coalition, to get us started and to introduce our speakers. So welcome, Nidhi.
Hey everybody, my name is Nidhi Shastri. I'm the organizer for the Illinois Single Payer Coalition's Patients Over Profits campaign. I'm really excited to welcome all of you to our virtual town hall, so thank you so much for being here. The Illinois Single Payer Coalition is a healthcare justice nonprofit, and we're currently running a campaign called Patients Over Profits. Our campaign ask is that Senator Durbin and Duckworth sign our pledge to stop taking over $200 in campaign contributions from the healthcare and pharmaceutical industries. We believe that the current for-profit healthcare system is inherently unequal, and in the midst of a pandemic, we need our legislators to act now. So we have a petition that individuals can actually sign to stand with us on that pledge. So the link to do so is in the chat. So if you haven't looked at that or signed it yet, you can go ahead and click that in the chat. So without further ado, I'd like to introduce our first speaker, Representative Chuy Garcia. Representative Chuy Garcia represents Illinois' 4th Congressional District in the United States House of Representatives. He has been a consistent, strong, progressive voice for the working people and immigrants of Illinois through his roles in the Cook County Board of Commissioners, the Chicago City Council, and the Illinois State Legislature, and now the U.S. Congress. So take it away, Representative Chuy Garcia.
Thank you so much, Nidhi, and it's great to join you and Melinda, and of course, everyone on the call. Thank you, public citizen and the Illinois Single Payer Coalition for inviting me today. I'm delighted to be joined by the likes of Commissioner Brandon Johnson and Alderman Martin and all of the other fantastic panelists tonight. We're more than 7 months into the pandemic, and I know each and every one of us has been impacted personally, whether it's a loved one who's lost a job or died from COVID-19. This year has tested us more than we ever imagined. And regrettably, it didn't have to be this way. The coronavirus doesn't distinguish between individuals who have health insurance and those who do not. The coronavirus makes clear what's been true all along, that your health is as safe as the uninsured and the worst cared for in our communities. COVID-19 makes a clear case for Medicare for all. Earlier this year, as cases of COVID-19 began growing in my district, the number one question I received was, where can I get tested and treated? This was especially concerning and still is for the largely immigrant communities I represent. You see, for the millions of people in our country who lost their jobs because of the pandemic, losing a job also meant losing their health insurance. In fact, tens of millions of Americans have lost their health insurance in the middle of a pandemic and when they need it most. Having a healthcare system in which your access to care is dependent on your employment status is especially cruel for communities of color who have been especially hit by job losses during the pandemic, communities that were already more likely to be uninsured and underinsured before COVID-19 hit. And for immigrants, this is especially concerning given the inability to access our nation's safety net programs. I heard countless stories of neighbors who opted to not seek help because they lacked health insurance, only to show up in the ER when it became too late. COVID-19 has exposed a deeply flawed and unprepared healthcare system in our country. If there's anything that we have learned so far, it's that never again should health insurance be tied to employment. It is a recipe for catastrophe. By now, it's also obvious that the federal government lacked any coordinated response to the public health crisis. There were major missteps, missed opportunities, all in large part due to failed leadership from the White House. For one, we all remember states fighting for scarce resources such as PPE earlier this year. Medicare for All's centralized control would certainly have prevented this mess in the early days. And because of the fragmented nature of the US healthcare system, it is hard to track how rapidly coronavirus is spreading. Countries with a more unified system are simply better able to track the spread and intervene appropriately. Second, instead of putting all our efforts into ramping up testing capacity and containment measures, our government was tied up with the most basic of problems. Who's going to pay for testing and treatment of the virus? Until when and to what extent? And what rate will tests be reimbursed and providers be paid? While our country debated on who would pick up the tab, single-payer countries were busy moving around resources and preparing for the medical emergency that was to come. And then there was the significant confusion and misinformation about where immigrants, like many of my constituents, could access testing treatment for COVID-19. The CARES Act extended general funding for community health centers that play a critical role in immigrants' health, but they were stretched thin before the pandemic, and many are now overwhelmed and financially strained. Providing health care for immigrants is critical for public health. When millions lack access to health care because of their immigrant status, their health care and the health of our country suffers. Finally, while the CARES Act Provider Relief Fund reimburses providers for treating uninsured patients with COVID-19, we know it has several limitations. Most Americans can get tested for free, but patients are still receiving staggering bills in the thousands of dollars for care. Others did not qualify, and some hospitals simply decided not to participate. If this country had universal health coverage for everyone, that wouldn't be happening. And the federal government wouldn't be maneuvering to send billions of dollars in emergency aid to hospitals and state health programs. And these are just a few examples. I often hear how we need to get back to normal, but the truth is that we can't go back to normal. We must do better because normal won't cut it. We must learn from this experience, and we need to implement a Medicare for all system. COVID-19 not only demonstrates that we have a deeply flawed and fragmented healthcare system, it also painfully exposes the persistent health inequities in communities of color. Plain and simple, the for-profit healthcare system has failed Black and Brown communities. It's no surprise that parts of my district that are predominantly Latino and immigrant are also those without access to healthcare, and also the communities that continue to suffer the most during the pandemic. The positivity rates among our communities of color are staggering. The inequities we continue to witness are not naturally occurring. The structural racism we see in our healthcare system did not happen by accident or by chance. The disproportionate death and suffering afflicting working class communities was in effect explicitly codified into law. Reversing this damage requires us to do the same. It requires us to write the racism out of our laws. And Medicare for All is a racial equity policy. It may not resolve or dismantle centuries of institutionalized racism in our healthcare system, but it will ensure that everyone has access to the same healthcare. Now, more than ever, we must come together, organize and strategize about how we confront the unique challenges of this moment. Most Americans already support and are calling for a transformation of our healthcare system. Now it's time to get policymakers to execute. We cannot continue business as usual. The pandemic makes that clear. Instead, we must take bold steps to change course. Anything less will perpetuate the inequities that are silencing and literally killing our communities. People are suffering because they can't get affordable care. And unless we take bold steps, more will die from COVID-19. We need to ensure that if we face another public health emergency, we will be better prepared to protect our communities. Medicare for All is a bold but not so radical concept. When President Roosevelt proposed what we know today as Social Security, it was deemed as outrageously radical. Today, it remains one of the most popular, successful, effective programs. We are simply asking that everyone, and I mean everyone, have access to affordable, quality healthcare that is not tied to employment, especially during the pandemic. Imagine a world in which people didn't go bankrupt because of their medical bills, a world where your zip code or immigration status didn't determine health outcomes. These are the possibilities we can achieve if we take up the cause and fight for Medicare for All. Medicare for All reaffirms our belief that attention to healthcare issues is a basic human right, and that's why we fight for it. Thank you.
Thank you so much, Representative Garcia. Our next speaker is Dr. Susan Rogers. Dr. Susan Rogers is the president-elect of Physicians for a National Health Program, or PNHP. Recently retired, she is a volunteer attending hospitalist and internist at Cook County Hospital. She previously was co-director of the medical student programs for the Department of Medicine. She is also an assistant professor of medicine at Rush University and Rosalind Franklin University. You can go ahead, Dr. Rogers.
I had to unmute myself, sorry. Thank you so much for inviting me to talk to you today, to join this town hall and help promote Medicare for all. You know, Aristotle said, so they say, but he said, tell me how a man died and I will tell you where he lived. And that comment, it makes it seem as if he's still living here in Chicago, because the zip code where you live determines your life expectancy here more than anything else in this city. The healthcare inequities that have been here for decades have been purposely ignored and left to remain invisible and hidden in the highly segregated communities of Chicago. 35% of poor Blacks live in concentrated poverty here in neighborhoods where schools are poorly funded, if they're still open, where access to jobs are limited, where transportation is an insurmountable hurdle to being able to get to other city and suburban areas where jobs do exist, where unhealthy fast food is cheap and readily available, fresh meat and produce are not, personal safety is precarious, and access to healthcare is becoming more and more difficult. Even prior to COVID, life has been a struggle for day-to-day survival for many. It is this profound racial segregation here in Chicago that helped create and continues to contribute to the health inequities that we see. Although research clearly shows that being poor and living in segregated neighborhoods is highly correlated with poor health, we have a profit-driven healthcare system that incentivizes the placement of healthcare facilities in areas where they can make money rather than in areas where they can provide care that is needed. Hospitals are actually penalized for taking care of patients who are poor because they may cause them to have worse outcomes. Even now, the closure of Mercy Hospital will create a medical desert, leaving a large south side area with inadequate prenatal and maternal health care. And with Mercy Hospital closing, those doctors will leave the community too. The COVID pandemic has created a marked increase in unemployment, yet there are still cries pushing to continue the coupling of employment to healthcare. Not only were essential workers not covered by employer-provided healthcare benefits, they faced increased risks of getting infected with COVID without any neighborhood availability of adequate testing and treatment. Have we learned nothing? Why do we allow a private corporation sitting on billions of dollars in assets to close a needed neighborhood hospital that they own, leaving a neighborhood and its residents to go without? Well, we do have a solution, and that solution is Medicare for all. And with the current pandemic worsening the lack of access to care, the loss of employment, we cannot wait any longer. We need Medicare for all now. Thank you.
Thank you so much, Dr. Susan Rogers. Our next speaker is Dr. Pam Groenemeyer. Dr. Pam Groenemeyer is a board-certified anatomic and clinical pathologist and a small business owner of SEMC Pathology, LLC in Highland, Illinois, a pathology business that provides services to 6 critical access hospitals in southwestern Illinois. She is co-president of PNHP Illinois Southern Division and board member of Missourians for Single Payer. She is also vice president of the Illinois Single Payer Coalition Board.
Hi, my name is Dr. Pamella Gronemeyer, and I'm a practicing physician in Southern Illinois, specifically Madison County. I am a patient on Medicare and a small business owner. I own and operate a pathology and cytology service and laboratory that covers 7 critical access hospitals, 2 gastrointestinal GI labs, and several doctor's office patients. I have 7 full-time employees for whom I provide health insurance for the employees and their dependents, with premiums paid by the business and deductibles kept at $1,000 or less per year. Pardon me. If the employees reach the $1,000 deductible, I cover 1/2 of the cost of my employees' deductibles. As a physician, I know that healthcare is vital. My employees are my friends and my colleagues. We all work together to ensure that we provide quality medical care to all. Therefore, I want to provide health care to them. However, the costs are often overwhelming. As a physician, I'm on a fixed fee schedule and do not see cost of living increases. My vendors increase their fees, but I cannot. 2020 has been especially a difficult year with the cancellation of elective surgeries. As a pathologist, I saw the income of my business decrease. I had to turn to the PPP for payroll support. I never cut hours or laid anyone off. The health insurance premiums, however, remain the same, and in fact, already will go up 6.7% for the next year. As my employees get older, the rates rise. Small business owners like myself know that paying for health insurance is a cost that decreases the bottom line of the business, and as a sole proprietor, decreases the salary that I make. I work extra hours to pay for the health insurance for my employees. In addition, the cost of the health insurance limits my ability to pay raises or provide raises. Each year, the majority of any extra money for possible raises is consumed by healthcare costs. I would much rather pay a higher payroll tax than write a check to any insurance company every month for the insurance. Currently, I pay about $6,600 each month to the insurance company. Like many of our car insurance companies, I did get a rebate from my health insurance, the health insurance company, because of the COVID epidemic. It was $500. This $500 did not go very far. I know that Medicare works since I'm a Medicare recipient. I have been and am being treated for a chronic, possibly life-ending condition. Conventional Medicare works with supplements, lets me go to the doctors of my choice, and has right now insured my health. I am not unique in support of Medicare for all among small business owners. And I'm going to refer to a report that was produced in September 2019 by the Commonwealth Foundation. Unfortunately, it's from September 2019, so some of the facts have changed because we know the effect of COVID on small businesses, and we know the effect of COVID on costs in general and what's happening to small businesses. At the time of September 2019, there were 30.7 million small businesses in the United States. These are defined as those businesses with fewer than 500 employees. And there are a lot fewer with less than 25 employees. These businesses make up 66% of new private sector jobs and employ more than 47% of the private sector workforce. In a Commonwealth study, worries about healthcare coverage represented 1/3 of the major challenges facing small businesses. And as I said, this was in September 2019. However, I think with the fact that COVID came up and people are getting sick, I mean, the small business owners are like, the thing is, it's hard to let your employees suffer and not have health insurance. Small business owners want Medicare, improved Medicare for all. Our healthcare costs would be much more predictable each year. I mean, we would be dependent on a fee schedule set by the government, and we would be paid on a clean claim without arguing or getting pre-approval or without all the hassles we go through now. As the providers, we would be paying for we won't be paying for administrative costs, we'll be paying for healthcare. The American people would no longer be afraid of pursuing entrepreneurship efforts, since their healthcare and that of their new employees would no longer be tied to their jobs. Small businesses, as we know, are the heart of the U.S. economy. Improved Medicare for all would be a win-win for all, and that's why myself and many small business owners want and need Medicare for all. Thank you.
Thank you so much, Dr. Gronemeyer. Larry Hopkins is a rail crew driver for the transportation and maintenance company Halcon and president of Local 1177 of the United Electrical, Radio, and Machine Workers of America.
Good evening. My name is Larry Hopkins. I'm a local union president and Western Region Vice President for United Electrical, Radio, and Machine Workers of America. I live in Chicago on the southwest side of the city. I'm also a 10-year employee at Hopkins Rail Crew Transportation, hauling conductors and engineers to and from rail yards and hotels. We operate in about 40 states in the US and Canada. I would like to discuss why it's important to have Medicare for all and single payer. My employer provides an insurance plan that most hospitals and clinics do not accept. Many of my coworkers I talk to do not have access to health care, and my employer offers an expensive plan that has no upper limit in costs, and it will come out of our pockets. Our members deserve good health care, in which we do not have at this present time. I will continue to fight for Medicare for all. The UE passed a resolution at our last convention in 2019 for Medicare for all and single payer, because we need to introduce and pass a bill that will provide medical services for all. Thank you.
Thank you so much, Larry. Wendell Potter is a former health insurance executive who had a crisis of conscience and walked away from his job at Cigna, one of the country's largest health insurers, in 2008. He then became a vocal critic of the insurance industry and a leading advocate for reform, and is a best-selling author. He has founded two organizations, Business Leaders for Healthcare Transformation and the Center for Health and Democracy.
Thank you so much. I really appreciate this opportunity. Thank you, Congressman Garcia, for your work and advocacy. You know, as a flyer for this forum noted, we must transform our immoral for-profit healthcare system, as this pandemic has made clear. In my view, the pandemic has made it crystal clear that we need to do that in so many ways. It's shown us how absurd it is, as others have said on this call, that most Americans who have private health insurance get it through their employer. More than 45 million of us have either been laid off or furloughed during the pandemic, and many not only lost their jobs, but also their health insurance, and in many cases for their entire families. But during this pandemic, there is one industry that has been doing extraordinarily well, and that industry is the one that I used to work in, the health insurance industry. Just last week, we learned that because of the pandemic and the Trump administration's failure to take appropriate actions, 8 million more Americans were forced into poverty. The same day that was announced, United Healthcare, the biggest for-profit health insurer, reported another quarter of huge profits. In fact, the first 9 months of this year have been United's most profitable 9 months in its history. As Congressman Garcia noted, a big reason we have fared much worse than other developed countries is our deeply flawed and inequitable employer-based healthcare system. It's a system that is also causing enormous damage to many of our employers. And as Pam said, small businesses in particular. One of the organizations that I lead, as you noticed, is Business Leaders for Healthcare Transformation. One of our members earlier today joined Congresswomen Pramila Jayapal, Debbie Dingell, and Jan Schakowsky on a webinar to talk about the importance of moving to Medicare for all. And this is what Aaron Saeeden, who is founder of Well-Paid Maids, which is a home cleaning company in the DC area, said during that call today. I founded the business in 2017. It had been going very well. In 2019, we did $600,000 in sales, and we're growing into 2020 with 15 employees, looking like we would break 100 million in revenue. Unfortunately, due to the pandemic, I closed the business in the interest of safety in mid-March and stayed closed for many months as I waited in vain for the virus to be suppressed. Because we don't have Medicare for all, I was faced with a terrible set of choices in March related to my staff's health care. With no revenue coming in, my options were: one, keep staff working unsafely so we could afford their premiums. 2, shut down and kick them off their insurance plans to avoid going into debt. Or 3, shut down and keep the insurance accruing debt in a completely uncertain environment. I chose option 3. We stopped operating. I kept paying for 100% of the premium cost. And as of today, even with help from our customers and the PPP program, the business is close to $20,000 in debt to Care First, our health insurance company. I have until next summer to pay them back, and I did reopen in August, but with revenue down and cost up, I'm not sure how we can generate the extra funds necessary to pay that off ahead of next year. And so this is all because I didn't want to kick people off their insurance during a pandemic. That's our ridiculous system. Folks, it is a ridiculous system. Why in the world do we put up with a system in which health insurance companies are able to reap windfall profits while millions of our employers are struggling to stay in business and millions of our fellow Americans have been forced into the ranks of the uninsured and into poverty? The solution is obvious. It's improved Medicare for all. Thank you.
Thanks so much, Wendell. Commissioner Brandon Johnson represents Cook County's 1st District. Prior to serving on the Cook County Board of Commissioners, he taught social studies and reading in Chicago Public Schools and was an organizer for the Chicago Teachers Union. Last year, Commissioner Johnson championed a Medicare for All resolution that passed unanimously.
Hi, good evening, everyone. Really good to be with you all on this fine evening. So much work to be done as we confront 2 very dynamic, incredible pandemics. Of course, the one of structural racism, which is the regularly scheduled pandemic. And then, of course, there's this global pandemic of the coronavirus, both of which have certainly exposed the gross inequities that exist between many of our communities. What I'm, struck by in this moment is how little people seem to know about how isolating and debilitating poverty can be. In the district that I serve, particularly the portion on the west side of Chicago, Garfield Park, this community has been described as a developing nation because the violence and the poverty per capita is akin to that of a developing country. But just a couple of miles to the west, it's one of the wealthiest places in the state of Illinois, which is the village of Oak Park, where there seems to be a bountiful amount of access to wealth and particularly health. So when we fought, for a resolution that I passed recently, the Justice for Black Lives resolution, in response to the murder of George Floyd and the response to many of the murders that have taken place at the hands of the police, one of the things that we wanted to make sure that was pronounced in that resolution was fortifying our commitment to having Medicare for all a reality here in our country. I believe Cook County can lead the way. There's certainly some things that we can point to as Congressman Chuy Garcia, at the time when he was a Cook County commissioner, worked to expand through the Affordable Care Act, something called County Care. Here's what's fascinating about the Affordable Care Act and why we have to push to expand and make Medicare for all a reality. One of the safety net hospitals in the 1st District is called the Loretto Hospital. It's on the west side of Chicago. 70% of the individuals who receive care there receive care through the Affordable Care Act. 30% of them are on the County Care program. But here's what's also something that we cannot lose sight of, and I believe someone mentioned this in the chat, that 40% of those that work at this hospital, this safety net hospital, actually live in the Austin neighborhood. So as we fight to secure, I believe, one of the most basic human rights that we could have in our society, which is healthcare, it also provides an opportunity to stabilize our economy, because there's a direct connection between those that have access to healthcare and our ability to create and to expand jobs. But it's also very striking in this moment, and I'm really grateful to be joined by people like Congressman Chuy Garcia and Alderman Matt Martin, is that a couple of weeks ago, when the President of the United States tested positive for COVID-19, he got the best care available to mankind, the best care. And of course, it was government-sponsored healthcare. But just 7 months ago, one of the first deaths that we recorded in Cook County was a gentleman by the name of Reggie Ralph. And when Donald Trump got sick, he got the best care. Reggie Ralph was told to go to the basement of his parents' home where he died. It's a wicked system. And so this resolution that we are pushing and the organizing that continues to build throughout this country, we have to be vigilant in our efforts to secure something so basic as the ability to see a doctor. It's personal to me. My mother died at the age of 50. My father lost his job, and therefore we lost our health insurance. As the gentleman indicated earlier, when healthcare is tied to W-2s, that is a system that is set up for failure, especially when Great Depression era numbers of unemployment have been reached in communities like the ones that I serve, especially for Black and brown folks. That's a wicked system. Having grown up with asthma, if it wasn't for the county hospital, I would not have made it through one of the most difficult times of my life. And it wasn't perfect, but I used the Fantas Clinic and I stood in line to see a doctor, to come back in line to get my inhaler refilled. And that was a day-long project. We have to get this right. It is literally a matter of life and death. The number of children who are born into poverty, the number of children right here in the city of Chicago and the county of Cook that are homeless, the number of women who are raising families on their own to the best of their ability, and they cannot make the ends meet simply because the healthcare is not available or it's too costly. That system has to be changed. And so that is why I'm eager and glad that we are working with all due expediency to not just raise the contradictions that exist as corporations profit from the misery that they create, but it's also about making sure that we're pushing legislation and pushing it with urgency to make sure that Medicare for all becomes a reality. And so again, I'm grateful and thankful for the conversation tonight. And I look forward to the fight ahead as we look to transform our country and do it in a way that makes justice to reality, especially when it comes to healthcare. Thank you.
Thank you so much, Commissioner Johnson. Alderman Matt Martin is serving his first term as Alderman of the 47th Ward of Chicago. Prior to serving as an alderman, he worked as a civil rights lawyer at the Illinois Attorney General's office, where he worked on important issues including police reform, immigration, healthcare, and workers' rights.
Thank you very much, Nidhi. To you and your colleagues, public citizen, to Congressman Garcia for putting together this incredibly important event. We all know how much we're struggling throughout our city, our state, our country, and beyond as we grapple with the pandemic, with especially this recent surge that we're feeling throughout the country right now. And with that surge going on, I feel fortunate to have this job because I can take my anxieties, my frustrations, and put them back into the job, figuring out ways, both big and small, that I and the folks in my office can help our constituents. But especially at the local level, with our fingers on the pulse of our community, we're all too familiar with the sort of struggles that people are feeling that COVID has exacerbated, all the sorts of structural inequalities that have already been discussed, whether it's housing inequality, healthcare inequality, education inequality. And we've had too many conversations, way too many conversations with folks who've lost their jobs, looking to contact the state. The lines are busy, wanting to submit their applications for unemployment. And so we help them through that process and also ask, how are you doing when it comes to housing? How are you doing when it comes to healthcare? And for too many of them, that sense of fear and frustration is so palpable through the phone when it concerns they've lost their jobs and now they've lost their health insurance and worried, okay, how much money do I have left in my bank account? Can I make it through the end of the month? How sick am I or do I expect to be? How sick do I think my kids are going to be? And these are incredibly sobering, incredibly sad conversations to have. But we also know that even when people transition jobs, they're having this conversation. If it's, say, a couple who's fortunate enough both to be employed with health insurance opportunities, there's still a question of how much money is this going to cost us to go from one to the other? Again, thinking, how much money do we have in our bank accounts? How sick do we think we're going to be? How sick are our kids going to be? That's not right. And it doesn't have to be the reality anymore. I feel really fortunate to have colleagues like Brandon Johnson in Cook County who have shown the way, shown us what local government can be, that it's not just about potholes and it's not just about rodent abatement or trimming trees. It's not just about our budget, it's about everything in between. And that we need to consistently demand, as members of city council, the sorts of bold transformational change that need to occur, not just at the city level or the county level, but the state level and the country level. So it's incredibly inspiring to see what Commissioner Johnson and his colleagues have done in terms of shining a spotlight on these inequities and lending their voice as Cook County government officials to that fight. And it's a call to arms for city council. So I very much am looking forward to working with my colleagues in urging Congress to pass Medicare for all, and in doing so, declaring consistently and aggressively and persuasively that healthcare has been and needs to be a human right. Thank you.
Thanks, Alderman Martin. Melinda St. Louis and Brittany Shanahan organized with Public Citizens' Medicare for All campaign and have been coordinating a nationwide coalition effort to win municipal resolutions in support of Medicare for all.
Thanks so much, Alderman Martin and Commissioner Johnson and Representative Garcia, everyone so far who have shared their amazing experience and expertise with us tonight. And I want to transition to talking about how we translate our outrage at the current for-profit system, what we've learned about tonight, what really the wickedness that Commissioner Johnson talked about, how we translate that outrage into action. We know that the insurance companies and big pharma are spending millions to block change and spread lies about Medicare for all. And we are not going to be able to outspend them. So we really need to organize, right? So in Illinois, Representative Garcia is joined by Representative Danny Davis, Representative Robin Kelly, Representative Bobby Rush, and Representative Jan Schakowsky in co-sponsoring Medicare for all legislation. But the rest of the Illinois congressional delegation hasn't yet co-sponsored these Medicare for all bills, even though polls show that a majority of people support Medicare for all. Fully 88% of Democrats support Medicare for all. So really, this is a no-brainer, and they need to hear from their constituents. So even those who have already co-sponsored the bills need to be encouraged to be stronger champions on this. We know that no matter who wins the White House or whoever is in the majority in Congress, we have to build a movement in order to push them to actually take action. And we know how urgent it is because of the pandemic. So your senators and representatives need to hear consistently from Illinois residents. So calls, emails, and letters urging them to support Medicare for all. And as we discussed tonight, we really need to organize at the very local level. And one powerful tactic to do that is to mobilize in our communities to win local resolutions like what County did under Commissioner Johnson's leadership to support Medicare for all, because then those officials, elected officials, become part of our army that is able to push for change. And so my colleague, Brittany Shanahan, who's been supporting activists all over the country to win these local resolutions, can share some resources that we have. And I really encourage you all to sign up to learn more and to be a part of it. So Brittany, if you want to just share quickly some of those resources.
Hi, my name is Brittany Shanahan, and I have had the honor of supporting national leaders across the country in cities and towns, large and small. And it's been exciting to see how everyone from longtime single payer advocates to folks who have never organized before have been able to dig in and use the tools we've created to help build the movement in our communities. I will share with you very quickly just a little bit of the step-by-step guidance and resources we have. Melinda just shared some of the links. It's all available on the coalition website at www.medicare4, that's 4 as in the number 4, so www.medicare4allresolutions.org. So let me share my screen real quick. Okay, so I am here on our Tools for Activists page, and I wanted to show you a little bit about this. We have this step-by-step toolkit here to help you organize your first meeting, to help you recruit a council member to champion your resolution, and to help you mobilize supporters ahead of your meeting, to get you resources to prepare a press kit, all that kind of good stuff. It's based on a lot of things that have helped other people, so it becomes easier for each new group. I also want to show you just quickly some additional resources that we have to help you tie in the importance of your resolution into the global pandemic that we are in the middle of. So that is right, COVID-19 resources and talking points. We will share these links with you in the chat as well as in the notes and the email and the recording that we send out afterwards for anyone who's worried that they'll have forgotten where it is, but it is on the Medicare for All resolution and in the Tools for Activists page. So in this COVID-19 toolkit, we have these additional resources, including talking points relating COVID-19 to the urgent need for Medicare for All, some sample resolution that ties the crisis into your resolution as a main argument for why we need Medicare for All. We also have a guide to writing a letter to the editor of your local paper. Next, I'm going to show you this list of past resolutions. I'm going to go to the main page and click Take Action in Your Town, and then find your town. So here is our map. We have listed all the towns where an activist has worked on a resolution since the start of this campaign. We also have a list of the resolutions passed right here, and you can click on any of these in order to see have a look at what the resolution looks like. So for example, here's St. Paul that takes us to that resolution. We actually have on this map here, we have more than 350 efforts, which is really exciting. And if you haven't already, we encourage you to sign up to join one of those efforts near you, or even better, if there isn't a dot on the map to show where your town is, you can sign up and we'll help you get one started. We need your help to move some of these over the finish line, as well as to restart some that maybe some people started before COVID to get things going again, and to fill up the map with dots from coast to coast. The green dots here represent resolutions that have been passed, and you can also sign up. There's two ways to sign up. You can sign up by clicking any of the blue dots and then clicking this link, and that'll take you here, or just click Take Action in Your Town and then sign up, and you can pick the town that you want to join or type it in that form. In addition, like going back to the toolkit, we do actually have links to our past webinars. We have a variety of presentations and fact sheets that our activists and organizational partners have found useful in their organizing efforts. And in addition to all this, we also offer one-to-one support. We have monthly webinars and regular calls for activists who are actively meeting with their local groups to share tips and strategies, especially after passing a resolution in one place, to feed back to other folks who are thinking of passing a resolution, to keep that momentum going, and then finding folks in the town next door to keep building the momentum in that area. So again, we are recording all of this and we will send you a copy afterwards. So if you feel like you missed something, don't worry. We're here to help you at every step of the way. I look forward to working with you. So make sure you sign up on the map if you haven't already. And again, the website is www.medicareforallresolutions.org. Now I'd like to pass the mic over. Let me stop sharing. I'd like to pass the mic over to Dr. Gronemeyer again, who I think had some thoughts to add on the town meeting system in Illinois.
Yeah, I was just going to talk about an effort because I'm in a part of Illinois where it's sort of hard to get my townships and my county boards to pass resolutions. But in Illinois, there's a unique township rule that all of us have townships structures, and at the annual meeting, which is the second Tuesday in April after 6 p.m., you can bring a petition to the meeting to request that a resolution get put on the ballot. What you do then is you bring everybody you know to the meeting, and everybody who votes yes to get the resolution on will get the resolution on. And I know it works because I got a move to amend resolution on the ballot in 2014, and it passed by 77% of the vote. The beauty of this is also you're subjecting it to the people in the township voting on it. So we could do this in all the townships in Illinois and do this. I mean, it's a much faster and easier way. Well, for me, it would be impossible probably to get my board to agree right now and for the cities to agree. But I think this is a beautiful way. And I put the link to the Illinois Township Rule in the chat. And if anybody has any questions about this, Melinda can give out my name and my email, and I'll contact me and we'll work on it. I wanted to do it this year, but the meeting was canceled because of COVID, and then they've never had a meeting, and I could never get it on the ballot, but it was my goal to do it this year, but COVID stopped me, but I'm going to try it next year. Thanks.
All right, thank you so much, Dr. Gronemeyer. I want to thank all our speakers and supporters for standing up for this cause and being here. I also want to thank Melinda from Public Citizens for all her help in coordinating this town hall. As the Illinois Single Payer Coalition, we believe that healthcare is a universal human need. We are respectfully requesting that Senator Duckworth and Senator Durbin sign our pledge to stop taking over $200 in campaign contributions from the healthcare and the pharmaceutical industries. Through this campaign, we have put together a letter and a petition asking the senators to take our pledge, with multiple legislators, organizations, and constituents signing on. If you're interested in signing on, please let us know. In this time when racial minorities are dying disproportionately from things like COVID-19, and low-income essential workers like my own mom, who's an immigrant and a single mother, are putting their lives on the line at work every day and at risk of getting sick and losing their jobs and insurance, who else do we look to if not our elected officials like Senator Durbin and Senator Duckworth to do what's right in this pandemic? We hope that we can encourage our legislators to give this policy, Medicare for All, the urgency that it needs. We would also like to ask those attending to make note of two very important call to actions happening this week. First, tomorrow, Tuesday, October 20th at 4 p.m., a coalition of healthcare justice groups, unions, and community organizations will be protesting against the proposed cuts at Cook County Health and the slated closure at Mercy Hospital. We ask that you join us at this action if you're able, and we will be assembling at the Thompson Center, which is located at 100 West Randolph Street in downtown Chicago. Second, we ask that you attend our all-state meeting this Thursday, October 22nd at 6 o'clock p.m. Central Time. It will be online, and the link to join that meeting is in the chat. We will be using that time to discuss our Patients Over Profits campaign and all the next steps forward from here. So we thank you guys all for taking the time to stand up for what's right, and I'll now hand it off to Melinda.
Great, thanks, Nidhi. I want to also invite Sheila Garland-Olanaran, who is a member of the Illinois Coordinating Committee of the Poor People's Campaign, the National Call for More Revival. Sheila was originally from Flint, Michigan, and she's organized across the country, most recently with National Nurses United, organizing registered nurses into the union from Nevada to Florida, and helped to push for the Cook County resolution last year. So welcome Sheila to say a few words, and then we'll end the evening.
All right, well, good evening, everybody. It's really an honor to be here. I guess I want to say that I feel like I'm picking in some pretty tall cotton with some of the folks that have spoken before me. Thank you so much, Melinda. I'm sorry.
Can you turn on your video?
Sure.
Oh, there it is. Great.
Okay. Thank you, everybody. It's really an honor to be here. And as Melinda said, the Poor People's Campaign, a national call for a moral revival, is working with Public Citizen and so many other organizations around the country. I just wanted to say a little bit from a different perspective, because the Poor People's Campaign, as most people know, we're nonpartisan, so we don't endorse particular policies, but we're very political. So I really want to talk a little bit, just briefly, about what we've been doing around building with the people who need healthcare the most, who are coming together in an unprecedented way, who are poor, Black, white, immigrant, non-immigrant. We have 44 states around the country where we have active campaigns that are fighting around these pillars that really talk about racism and environmental injustice and the need for healthcare. And I want to say that from our experience with history, the people who push from the bottom tend to push the entire society upward. And so in the Poor People's Campaign, we actually are building that diverse, multiracial, multicultural army of fighters who are going to win healthcare for this entire country, because we need it. We have no other place to go but to fight and to fight forward. And Reverend Barber likes to say we're entering in a period of a third Reconstruction. And we know that the Black Reconstruction was led by the newly freed Black slaves who had nothing to lose but their fetters, and who had everything to gain by pushing society. And what that entailed was a coming together of Black and white workers across this country in an unprecedented way. But we also know that this country was brutal and completely brutalized white workers to convince them not to join with their Black brothers and sisters to fight for what they knew was right. And so this is what we're endeavoring in the Poor People's Campaign to guarantee, and I see it every day, people who never thought that they would be fighting in a campaign like the Poor People's Campaign, newly poor. I mean, we're talking about over 250,000 people yearly were dying from poverty and poverty-related violence in this country. And that has only increased with this pandemic. And so people are struggling in order to get healthcare. And the Poor People's Campaign is 100% on board with this fight, this demand that's bubbling up from the very bottom of society that will push this demand for healthcare over the finish line in the very near future, we sincerely hope. It is unconscionable that the numbers of people that are falling into poverty, who are becoming homeless. In fact, we have reconstituted the National Union of the Homeless, and we are figuring out ways to deliver healthcare in a way that states and systems have been unable to do, joining together with doctors and nurses and other healthcare providers in the homeless camps to guarantee that the very people who need healthcare the most are able to access it. And so I just wanted to say that we are with those of you who are in this fight, even though we're not endorsing particular policies, but we are in this fight because we know it is the moral thing to do, that this country has no ground to stand on from a moral perspective to continue to deny healthcare, most particularly in a pandemic. And I just wanted to say two more things. One, that the closing of Mercy Hospital is absolutely unconscionable. And it again represents the kind of violence that we see visited upon communities that can least withstand it. But before Mercy Hospital closed, remember that the child and maternal unit of Jackson Park Hospital, deep on the south side of Chicago, closed those services when that was the community that saw the most infant mortality deaths, that saw the most deaths among maternal deaths, and that hospital closed those services to that community. And now those vulnerable populations are being forced to go to other places to try to seek care at a time when a woman is at her most vulnerable, and that the newborn baby is at their most vulnerable. So we have a lot of work to do. The Poor People's Campaign is here. We're not going anywhere, and we will continue to join with and fight and demand healthcare for all as a human right.
Thank you so much, Sheila, and to the incredible leadership of the Poor People's Campaign and all the work that you all are doing in Illinois and around the country. And I see that we have come up to the hour, and that's just because we've had such an incredible and robust discussion with all of the amazing panelists. I'm really excited about all of the engagement that everyone's had through the chat as well. I've seen people are asking, are we going to make the recording available? We'll have that available tomorrow. We will engage with you. Please sign up to both the People Over Profits Pledge as well, or the Patients Over Profits Pledge, as well as the Medicare for All resolution. Sign up your town. We're going to build this movement. I really want to thank again Representative Garcia for his incredible words and leadership. We will get his presentation and share it with everyone. I think it was so powerful. Commissioner Johnson, incredibly moving. Alderman Martin, we're really excited to continue to work with you to have leadership in the Chicago City Council as well, and all of our amazing speakers from across Illinois for sharing your insight and expertise with us. And again, most importantly, grateful to all of you who joined us as attendees tonight. Tune in. We do urge you to sign up on the map, and the Medicare for All resolutions map. We'll post that link in one more time. And again, please stay safe in these unprecedented times. We've got our work cut out for us in so many fronts, and we're really grateful for you to be a part of this fight for healthcare justice and guaranteed healthcare as a right for everyone. So thank you so much, and have a great night.